know that joint pain is one of the most common reasons people seek physical therapy? Tonight we'll dive into why that's the case and how you can keep your joints healthy and pain-free for years to come. I'm physical therapist Andrew Sipowicz. Tonight I'm joined by fellow physical therapist Jake Woodrich, and together we'll walk you through the basics of joint health and share practical strategies you can use to take care of your joints. While this class is packed with education and exercise, it's always important to check in with a healthcare professional if you're experiencing significant discomfort or if you have a medical condition. Feel free to drop any questions you have in the chat throughout tonight's session. We'll make sure to answer them during our live Q&A. Let's get started.
So one of the biggest things about joints is that you have several different types within your body. And one of the biggest things about that is that they all need to move a little bit differently, whether it's the shoulder joint or the knee joint or the hip joint, they all work a little bit differently there. There's different things like ball and socket joints or hinge joints. A hinge joint would be like the knee, how it moves back and forth, kind of like a door hinge, where a ball and socket joint would be like the shoulder or the hip, kind of like a golf ball on a tee sort of thing. It's super important though that all of these joints are constantly moving in different directions and in different ways so that we keep them healthy. One of the important things about the joint is that there are different structures that help provide stability to it. I use two different terms. One term is static stability, or does not change. I also use dynamic stability, or can change. Static stability would include things like ligaments, cartilage, joint fluid, bones, all those structures that don't really change that much over time. Where dynamic stability is more about the muscle and the different tendons and things that surround the joint to give more stability in there as well. So when your joints are moving, obviously they need to be able to move to go upstairs, to sit, to stand, different activities throughout your day. Your joints have to move in certain directions, like I talked about, in multiple planes of movement. So moving forward and backward, side to side, rotating through those planes of motions. Different things like that are really important throughout your day. So that joint stability as they move in those different planes of motion are really important. Whether I'm lunging down to pick something up or going up steps or going in and out of a chair, they have to move different directions in different ways. And if you don't have the stability to be able to do that, it can present other issues as well.
So there's a lot of different factors that might influence your joints. One of the primary ones is aging. Unfortunately, we can't stop the aging process, but there's a lot that we can do to help mitigate those effects on our joints. As you get older, your cartilage starts to wear down, your joints don't produce as much fluid to make that movement in your joints, smooth. So there's a lot that we can do in terms of mobility and strength movements that help to keep your joints moving for a lot longer. Another factor that can really affect your joints is being sedentary. So if you aren't moving as much, your joints are going to stiffen up on you and they're not going to be able to move as well. Other factors might be high impact activities. If you're continually putting a lot of stress and impact on your joints without doing proper recovery or proper exercise, that'll start to wear down your joints a little bit quicker. So a lot of high impact activities that we'll see issues with are running, a lot of sports, specifically maybe football, basketball, anything where there's a lot of running, jumping, cutting. Those are typically where we see a lot of wear and tear with our joints.
Yeah, and one of the things I would add with that too is it's good to have those like exercises and different things like that, but if you do the same thing over and over and over again, it does wear at those joints. So you have to kind of have different variation in exercise and things like that too.
Yeah, a lot of repetition with joints can also wear them down. If you aren't providing different sort of movements or exercises to those joints, that's typically going to wear those specific joints down quicker. So two really important factors for joint health is your flexibility as well as your strength. So one thing that we really want to focus on initially is making sure that your joints are moving in a full range of motion. The last thing that you want to do is start to strengthen a joint before it has its full range of motion, because what can happen is that joint can stiffen up in that limited range. But once you have that full range of motion, your body then has to control that motion. So by improving the strength with the muscles around that joint, that's really what's going to get your joints to a point where they're feeling and moving a heck of a lot better. When you're improving your flexibility and your strength of the joint, what you're doing is you're working on those muscles to help essentially offload the bony structures of your joint. So a lot of times, especially with the aging process, those joints start to become rough. And when you start having rough joint surfaces rubbing up against each other, that's going to cause issues like inflammation and pain. So by improving the strength in those muscles, it allows your body to do a little bit more decrease in load management on those joints.
So we talk all about getting this mobility and stability in the joints. How do we improve that? Just simple exercise. So there's a bunch of different things that we can do to improve mobility or improve stability, and really basic exercises that you can perform every single day or even a couple times a week, different things like that to start yourself on this path. One of the things day to day that a lot of people talk about is posture. And while posture isn't the be all end all of everything, it is a starting place. And I think it's super important to have a good starting posture to put yourself in a good position when you are exercising or when you are moving. That's your starting place. If you start in a good spot, you're going to finish in a good spot as well. It gives you that better chance throughout the whole movement. So one of the things about posture and putting yourself in one of those good positions before is ergonomics and different things that we can do to adjust how you are day to day. So one of the things I tell people a lot is that I want you to sit and stand at work throughout your day, or sit and stand when you're at home throughout the day. You don't want to be static or in one position for too long. Otherwise, that does put a ton of stress on the joints. Just like we talked about with repetitive exercise, you don't want to just be in the same thing all the time. And it's the same thing with static positioning as well. But when you are in those sort of positions, it's important that you give yourself the best possible chance to be healthy with your joints. So whether that's, eyes, monitor a little bit below eye level, whether that's sitting flat on the ground or flat in the chair with a little back support with your feet on the ground there, things like that do help put yourself in a little bit of a better position throughout your day as well.
So we have our skeleton here, so that way we can take you through some of the joints that we talked about earlier. That way you have a little bit of a better idea of what we're talking about. So let's start here with our shoulder joint. So this is that ball and socket joint that Jake was talking about earlier. So you can see here you have the ball, which is the head of your humerus, and it sits right inside the shoulder cavity here, kind of part of the shoulder blade. And so this joint allows for a lot of range of motion. You can do a lot of overhead movements, reach behind your back, all that sort of stuff. Now, if we move down the arm a little bit closer towards the elbow, this is more of that hinge joint. So you can see here, it's more of just a one-directional movement, a lot of bending and a lot of straightening there at the elbow. With a lot of these joints, one of the major issues that we see is osteoarthritis. And so what that is essentially the joint having too rough joint surfaces. So one of the more common areas that we see that is at the knee. So with the knee, you have your femur here that sits on top of the tibia, and it creates, again, one of those hinge joints. So what happens is that the two joint surfaces here, you start to get a little bit of roughening of those joint surfaces, and sometimes that's due to wearing of the cartilage in that joint. Again, part of the natural aging process, unfortunately, you do start to develop some of that arthritis. Now, common symptoms that we see with arthritis is a lot of morning stiffness. So when you first get out of bed, generally your joints are stiff, achy. As you go on throughout your morning, that pain starts to come down a little bit. Again, we also see a lot of issues with overuse with arthritis if you don't have the proper strength and stability of that joint. And because the joint is worn down, again, that can produce inflammation. So that's generally one of the more common issues that we see is that arthritis. Another very common injury that we see is tendinitis. Now, more common that is at the elbow. A lot of people think of tennis elbow or golfer's elbow. And essentially what that is inflammation of the tendons of your forearm flexors or your forearm extensors. And those muscles attach right into the sides of your elbow there. So this is generally an issue or injury that occurs with repetitive motions that you really just don't have the strength to support. So a lot of times what we'll see is inflammation in that area. You'll get some swelling. You can also have a lot of pain and discomfort with whatever motion or activity bothers you. So like with tennis elbow, it's typically, with backhands with a lot of extension of your wrist. Golfer's elbow, a lot of times that's from the impact when you hit the ground. It produces a lot of force at the inside of your elbow, and your muscles and the joint just aren't strong enough to support that activity. Last injury that we're going to talk about is ligament sprains and meniscus injuries. So your meniscus is located at your knee, and you have two of them, one that sits on the inside of the knee and one that sits on the outside of the knee. The best way to think about those is essentially shock absorbers for your knee. So they're responsible for any sort of impact to your joint. When things like squatting, jumping, running, those are what both your meniscus are typically responsible and used for. Now, ligament issues is you have four primary ligaments in your knee. You have your ACL, your PCL, your MCL, and your LCL. Now, those ligaments are used to keep the stability in the knee, and a lot of times if you have an issue with those ligaments, you'll get a lot of weakness in the knee. Sometimes your knee might give out, and obviously we don't want that to be happening. So ways that we go about improving those issues is, one, keeping your knee in more of a straightened position to start. And the reason why is that that's the most protective position for your knee. And once we can improve flexibility with your hamstring and your calf, generally we'll then start to work into a little bit of light strengthening in areas that don't produce a lot of pain. Then once you're able to tolerate more of that lighter strengthening, we gradually work into more functional based movements.
And with stuff like this, there isn't necessarily a way to perfectly prevent an injury, and that's the case with a meniscus or a ligament issue. But one of the things that kind of unlocked things for me as I was working through PT school and becoming a PT was talking about dynamic stability and static stability. And I talked a little bit about it earlier, but again, those ligaments and that meniscus in there are static structures. They don't change. They are what they are, and we can't change them. What we can change is the muscle around it and the tendon around it to create more stability around that joint, and that's why that strength is really important around it. So obviously talking about strength is really important to help maintain that joint stability and also that joint health, but there are other ways to help reduce some of that stress on that joint. Especially what comes to mind for me is the knee joint a lot of times, where if we are a little bit overweight or if we are gaining weight at certain times, it can put more stress on different joints there, especially at the knee or at the foot or at the ankle, in different spots there where that compression, and you can kind of see if I'm compressing down, I have gravity and my body weight pushing down on this. If I'm pushing down on that knee there and I have the floor then pushing back up, it creates more compression at that joint as well. So we want to make sure that we don't compress that much there. So losing a little bit of weight sometimes can help decrease some of that joint stress as well. So we talk a lot about strength, and I think that's super important, but obviously stretching and maintaining your mobility is important as well. And I know Andrew talked a little bit about it with when you have a meniscus injury or you have an injury like that, a joint injury, we do try to initially increase some of your flexibility. There's muscle imbalances that can start to throw some things off as well, and we want to make sure that we have the proper balance around a joint. Again, for example, at the shoulder, think of that ball and socket joint, right? That golf ball on a tee. You have different muscles that surround it, almost like a cushion, kind of around that joint to create a stable structure in there. And if one is a little bit off, one's a little tighter than the other, one's a little bit more than the other, one's a little stronger, one's a little weaker, it throws everything off a little bit in that way, and it can affect the joint then. So we want to make sure we're stretching the right structures, strengthening the right structures, and most of the time it's usually a combination of both.
I think that one of the biggest things is why we want to improve the flexibility is initially after an injury, you're going to get a lot of muscle guarding. And so we want to focus on stretching initially to get those muscles to relax. And I should go back, but what I mean by muscle guarding is when you have an injury, your muscles tighten up to try and protect you, essentially. So by going through flexibility and mobility training early on in your care, that's going to help those muscles to relax and start to get back to a length that they were prior to the injury.
So we talk a lot about putting yourself at the greatest chance of success in all your different joints. And one of those things is the warm up and making sure you're properly warmed up before any physical activity, whether it's just lifting stuff around the house or moving stuff around the house, or if you're exercising or going for a walk or different things like that. It's super important that you have that warm up to get the blood flow to all those joints, to get the blood flow to all those muscles so that they are at their peak when you are doing whatever you're doing. And then afterward, it's making sure that you cool down and you also take advantage of the fact that your muscles are warm now, they are flexible now. Let's make sure we maximize that. And they found that stretching after exercise does actually maintain mobility really well. So that's something that's super important as well.
Buffalo Rehab Group has my trust and vote of confidence. I highly recommend working with Katie at Buffalo Rehab Group. She is intelligent, uses care when working with me, and is very compassionate.
I've been working with Tyler Pacer from Buffalo Rehab Group since May. He's been very knowledgeable and easy to work with.
Kayla McClure makes PT feel more like a spa day.
Sean worked for me and got me back on.
Kathy is warm and welcoming.
My physical
greeting
therapist is
everyone with
Savannah
Brandy was
Warner,
kind,
and she's
smart as
compassionate.
heck.
I got my life back
at
Buffalo Rehab Group.
So a couple different things that you can do for a warm-up, and I'm going to have Andrew demonstrate them for us here. So the first one is just a real kind of mini squat, right? Nothing real intense here, but you can kind of pick up your speed, pick up your pace as you're able to, or you can go as slow as you want to, right? If you're just kind of going up and down, nice and slow and easy. You can vary your depth based on how deep you feel comfortable going, but this is a good way just to kind of get your hips going a little bit, your knees, your calves, every little thing kind of in your legs going before you get moving. So with those squats there, you can do like half squats, and that's kind of like the middle ground there. Now, if I want to make that harder, you can go lower. You can have a chair behind you and go to a chair. You can add some weight, which makes it a little bit tougher as well. Or if I want to make it a little bit easier, again, it doesn't need to be as far down. It could just be a real small little motion there. You can hold on to something and help as you're going down, things like that. But those are really simple ways to kind of progress it or make it a little bit easier for yourself as well. And the other one I'll show you here too, just to kind of get everything rotating. We talked about the different planes of motion and getting you moving in different planes. So one of those things is just kind of rotating side to side. So if you rotate side to side there, good. And again, use your hips. Let those feet come up and just rotating side to side. You're getting your upper back moving, you're getting your hips moving a little bit, different things you're going to have to use in day-to-day life. So if you are struggling to rotate, what you can do is also work in a different plane, right? So we talked about moving in different planes. Moving this way, you could just go arms across your chest and just kind of work in here. You could do this sitting, you could do it standing. You can also kind of work up overhead. Maybe your arm needs to get loosened up a little bit and warmed up. So almost like you're bowling and trying to reach for the ceiling as you go up here. Those are different ways you can add some upper body mobility and make it more challenging or a little bit easier for yourself as well.
Now that we're warmed up, we're going to get into a little bit more strengthening-based movements. So first thing is with strengthening exercises, generally I don't have my patients do them more than 3 to 4 times a week, just because you want to give your body a proper recovery time in between each time that you're working on and improving your strength. So the first exercise that I'm going to have Jake go through here is what we call a chop and lift. So it's combining a little bit of squatting as well as a little bit of overhead lifting to work on not only your lower half but also your upper half. So what I'm going to have Jake do first is start with his hands at his right hip. He's going to go down into a little bit of a squat, reach to the outside of his right hip, and then stand up nice and tall and reach up over his left shoulder. I'm going to have him go through a few of those, and first thing is, as they get easier, one of the progressions is we'll start to have him move into holding a little bit of weight while he's going down into a squat and lifting up overhead. As he gets comfortable with that, we'll have him go a little bit deeper down into that squat and really stand up nice and tall and work on that rotation up overhead. If you're having trouble with the rotation, we can go back to what we did earlier with the standing and rotating, is go hands kind of across your chest, go into a little bit of a squat and rotate back towards your right hip, and then stand up nice and tall and rotate towards your left side. I'm going to have them go through a few of those. Perfect. Just like that. The next exercise that we're going to work into is a lunge. And so what I'm going to have Jake do is face towards the wall here. And we're going to start with left foot moving forward. So I'm going to have Jake step forward with his left, go down towards the ground a little bit, and back up. Perfect. I'm going to have him go through a few of those. Now, if you're having trouble with taking that large of a step, one way that we can regress the exercise a little bit is go into what's called a stunge. And so what I'm going to have Jake do is just like that, is a little bit smaller of a step. So, perfect. Now let's switch legs here. So one progression for the lunges is going into that lunge position and adding a rotation over that front leg. So what I'm going to have Jake do is step forward with the right, rotate to his right, and back. Perfect. Now let's go through a few of those. Once Jake gets more comfortable with this, another progression that we can do is add weight to his rotation. Again, remember with the strengthening exercises, I don't want you to be doing these every single day. 3 to 4 times a week. Best to start with 2 sets of 10. Work your way up. If 2 sets of 10 becomes easy for you, add an additional set to make it 3 sets of 10 and work from there. And the last exercise that we're going to get into is everyone's favorite, and that's more core work. So what I'm going to have Jake go through is a plank. And so to get into a plank, the best way to do that is start on your elbows, and then you're going to come up onto the toes. Big thing with a plank is I want you to keep your back nice and flat. I don't want you to bring your hips up. So I'm going to show improper form here. So we don't want the hips to come up like this, and we also don't want the back to sag like that. So I'm going to have Jake hold that position, and instead of doing reps here, what I'm going to have you do is hold it for 10 seconds and start with that. And then perfect, come out of that position, Jake. Now, one modification that we can do for a plank is it's what's called a modified plank. So Jake, I'm going to have you go back down onto your elbows, and instead of coming up onto your toes, what I want you to do is just bring your knees back a little bit, just like that, and again, keep that back nice and flat. Again, hold this position for about 10 seconds and see how you do with that. Now, a way that you can progress a plank, you can come out of that, Jake, is getting back into the elbows and feet. And what we can do is add a little bit of weight shifting here. So keeping the back nice and flat, I'm going to have Jake shift a little bit of weight over to his left and a little bit over to his right, and just kind of go back and forth for those 10 seconds. What we can also do is I'm going to have Jake come up into a high plank. So what that is on your hands and then coming up onto your toes. And what we can do is shoulder taps. So what he's going to do is take his right hand and tap his left shoulder, and then alternate back and forth, just like that. Perfect. Good. And you can come out of that.
All right, so some different stretches that we're going to want to work on. This first one is going to work a little bit on your hip flexibility and work on a little bit of core as well too. So what I'm going to have you do here is you're going to put up your right foot onto the chair there. Bring this left foot back a little bit more. Perfect. And then from there, you're going to glide your hips forward towards that lead leg. And the big thing with this one, he's doing a good job of keeping his leg straight and his foot pretty flat on the ground and pull back. You might even feel a little stretch in the calf with this as you're doing it. And you're just going to glide into it for a couple of seconds and then back out of it for a couple of seconds. A way to kind of progress this a little bit further would be as you push yourself back, you go into a little bit of a hamstring stretch on the backside, right? So now you're kind of moving into this hip flexor stretch here on this side, and then as you come back, you work into a hamstring stretch on the other side. So you're working multiple different things with a stretch like this here too. Super helpful with things like walking, running. This is a really good stretch for stuff like that as well. When you do something like this, just hit 20 of them a day. Something really simple you can do early in your day to wake yourself up, get yourself moving. You can use it as part of a cool down after a workout or a walk, or you were up and active. This is a really good exercise for that. So this next stretch is very similar to what we just did, where we were gliding forward with the hip, but now we're going to add a little bit more to it. So again, you're up on that chair or on a step at the stairs, whatever is more convenient, and you're leaning forward into that leg. And as you do that, you're rotating over that front leg there. And the point of this is it's going to add, again, a little more stretch in the hip, a little more stretch in this hip as well on this side, and you're going to add a little bit more rotation in your upper back, which is really important when you're walking, moving throughout your day. It's the way it's supposed to move. Now it's moving like this. If you want to make this tougher, you can add some weight with it, hold something with it to make it tougher. Good, you can switch sides here then too. So make sure you're hitting both sides with all these different stretches. And again, this is something, if you just hit 20 times throughout the day, 20 reps of these throughout the day, super helpful to get your day started, cool down from an exercise or something like that as well. So next stretch we're going to do is something that stretches your back a little bit. It also stretches your hamstrings, and this is something that we definitely can get a little bit tight in, and it's important that we stretch this out. So what I'll have Andrew do here, feet shoulder width apart, and you are just reaching down to the floor and trying to touch your toes, holding for a couple of seconds, and then coming back up. Now, disclaimer with this one here, if you have a back issue, this may feel great. It may not, and that's why you want to make sure you get to a medical professional to determine if some of these things are good for you. But this is one that, if you are healthy and you are feeling good, it's a great way to stretch your hamstrings, stretch your back, and get all that loosened up. Or if you're doing a cool down like we talked about before, great way to stretch out after a workout or exercise. Again, something you can do a couple times. Maybe you're doing it in the middle of a walk because it feels good. Maybe you're doing it after a walk and you're doing 20 of them. Just get a bunch of these in at a time, once a day or something like that, and you're in a good spot.
So we're going to go through a couple different scenarios and just kind of talk through ways that you can work on different movements throughout your day and make them maybe a little bit more easy and manageable for you to go through. So one of the most common issues that we hear pretty much every week is people have a hard time lifting, especially from the floor. So whether that's doing laundry, picking up a child or grandchild, any sort of heavy lifting from the floor generally is giving quite a few patients potential lower back issues. So first thing I'm gonna do is just kind of talk Jake through some proper lifting mechanics that might help you throughout your daily life. Now, the biggest thing that I tell all of my patients is you really want to avoid lifting with your back. You really want to utilize your legs because that's where a lot of your strength and your power is generated. So what I'm gonna have Jake do is face towards the wall here. And kind of how we worked on earlier with our squats is I'm going to have him go down, pretend like he's picking up his kid. So Jake, with that, you're going to really kind of sit back into a squat, reach down towards the ground, and as you come on up, I want you to really drive through the floor and push through your feet, just like that. Why don't we go through a few of those just so everyone can see the proper lifting techniques there. So as you can see, as Jake's going down into a squat, his hips are coming back. He's avoiding what we call reaching or grabbing with your lower back, where you're keeping your legs relatively straight and bending down towards the ground. We don't want that. So really focus on getting down into that squat, driving through the ground with your legs and your feet, and picking up whatever you're having difficulty with. Another issue that a lot of patients have is after they're done lifting, carrying objects. So one modification that we can go through back to lifting from the ground is, again, I'm going to have Jake face towards the wall here, and you can go 1 foot in front of the other. And then as you do that, try and reach down towards the ground there. Perfect, just like that. So if somebody has issues potentially with mobility through their lower half, the split stance here is going to help get a little bit more movement through the hips to allow them to get down towards the ground. Now, let's say Jake's picked up whatever he's had issue with picking up, and now he wants to carry it. So one thing, especially when it comes to, let's say, groceries, if you're like me, you try and get everything done in one trip. That's not always necessarily the best thing for your joints. So one, breaking up trips from your car into the house into a few different trips is going to reduce the amount of stress on your joints, especially if you are dealing with an injury. Now, when you are carrying those groceries, let's say, into the house, one thing you want to really maintain is that upright posture. So as Jake mentioned a little bit earlier, the best place to start is making sure that your posture is up nice and tall and in alignment. And so what I mean by that is having your shoulders back, whatever you're carrying, having it close to your side, and then walking to wherever your location may be. So having Jake stand up nice and tall, hands down towards the side, and then pretending like he's walking those groceries into his house. Perfect.
So now that we've thrown all this stuff at you, what are the big things to take away from it? And the most important part of all of this is that movement is fundamental for your success. And these different stretches, these different strength exercises are really important to add into your daily life to help prevent you from having to ever come see us, hopefully. Obviously, that doesn't always happen, but it's super important that you maintain your joint health the best that you can, and these different exercises can help you with that. Thank you for joining us tonight. Let's cover some key takeaways from tonight's class. Your joints are essential for your mobility and your independence, so keeping them healthy is key. Incorporating strength and mobility exercises into your routine can help protect your joints, allow you to move with more ease and more confidence. If you're dealing with persistent pain, don't ignore it. It's important to seek professional guidance when needed to address any issues early on. Remember, if you need personalized care to treat any pain, discomfort, or injury you're facing, reach out to a certified health professional for the best plan of action to get your body healthy. Stick around for our live Q&A session where we will answer any questions that you have about what you may have learned tonight.
How long has pain been holding you back from the things you love? At Buffalo Rehab Group, we understand that life doesn't pause for pain. No matter what's holding you back, we offer a wide variety of services when and where you need them, from your foot and ankle to your knees, hips, and back. Our experienced team of therapists will guide you through a personalized plan of care tailored to your needs, ensuring a transformative journey toward a pain-free life. Don't let pain limit you. Visit us at buffalorehab.com and get your life back today.
Hi everyone, so we're going to go through our live Q&A here. The first question here is from Tim, asking about a program specific to senior golf stretching and strength. We actually do have an INDI program. It's called INDI, I-N-D-I, and it's a program designed by physical therapists. That one is actually designed by myself. So there is that option for you to get a little bit more golf specific on working some of that mobility and strength associated with golf.
Yeah. I would say the golf program is something that's super beneficial. It's really hard to tell, specifically if there's any sort of deficits with your, potential golf swing, but a lot of rotational movements are generally a really good thing for most golfers. So our second question here is from Rylan. They said, I've had bilateral knee replacements and a left hip replacement. I cannot get down on the ground anymore or kneel. I'm hoping you have chair exercises included, which luckily we do. So we're going to go through just a couple of chair exercises that you'd be able to do at home that can be pretty beneficial for most of your joints. So I'm going to grab a chair real quick. You want to just hold the mic for me? Yeah. Actually, I can hold it for you. How about that? I'll have you take a seat in the chair, Jake. So the first exercise that I'm going to have Jake go through here is called a seated hamstring stretch. So it's a really good exercise for your knee as well as stretching out your hamstring muscle. So what I'm going to have Jake do is let's kick your why don't we do your right foot out in front. Toe's going to be up towards the ceiling. And then Jake, what I want you to do is just gently reach down towards your foot. So when you're doing this exercise, what we're looking for is just a little bit of a pull on the back side of your leg. We don't want you to be pushing through any sort of pain. So get to that point where you feel a little bit of a stretch, hold that for a few seconds, and come on back up. Now, repetition-wise, recommend that you go through maybe 10 to 15 of these, and then also do the other leg as well. It doesn't hurt to do both sides. Another really good exercise as well it's called seated flexion. So this gets a little bit of the hips, a little bit of the lower back. So with your knees bent just like that, Jake, feet spread apart, you're going to take both hands and reach down towards the ground. Same concept here though, you do not want to be pushing through any sort of pain. So go to a point where you feel a little bit of a stretch. You might feel this in the lower back, might feel it in the hips. Each one hold for about 3 to 5 seconds. And same thing, you're going to go through 10 to 15 of those as well. So those are two really good stretches that you can incorporate into your daily routine, as long as they don't produce any sort of sharper pain.
Okay, the next question we had was from Kim. I have arthritis in my knee, love walking, but lately the front of the knee is buckling, causing a lot of pain. So one of the things that can happen over time is there can be some weakness that's developed with different reasons, and again, we would kind of have to take a look at it further to see if what that reason is. Is there something going on in the knee? Is it just muscle weakness? Is there something else going on? So there's different reasons that can happen, but we want to make sure that you do have that strength built up, and that's something getting really strong, especially in like single leg positions when you're walking, super important. Every time you take a step, you're on one leg, so you have to have that single leg ability and strength, and that can help with some of that buckling too.
So next question we have here is from Julie. The question is, does BRG have exercises for arthritis in the fingers and hands? So the good news is there is a ton of different exercises that you can do for both the fingers and the hands. And also at BRG we have a service line where we have occupational therapists. Now our occupational therapists are highly trained in hand, finger, wrist, pretty much full upper extremity sort of issues. So my recommendation would be to get an evaluation with one of our occupational therapists or physical therapists to figure out what sort of deficits that you're dealing with, so that way you can get the appropriate exercises for you.
Next question was from Elaine, and she wanted to learn about exercise to help her ankle joints, which hurt after exercising. The ankle is always a little bit tougher just because it's down further and closer to the ground. So you have all the weight from your body, all the weight from all the ground kind of pushing up at that ankle joint. So it does make it more difficult. One of the things that is super important, and we talked about it in the class with really any kind of joint, is just strength and stability around that joint. Same applies to the ankle. The more stable you are in that ankle, the better that you're going to be, and hopefully the better you feel after exercising. A lot of times with exercising, there is a little bit of soreness and there is a little bit of discomfort that you have to work through initially. As you get stronger, as you get better, that discomfort should dissipate a little bit. And if it's not, that's when you would want to go and see somebody to see, okay, what can I do about this? The next question is from Steve. The knee is a hinge joint. Why is no one calling out NFHS and NCAA for codifying forcing baseball pitchers to place their pitching foot parallel to the pitching rubber and pushing off sideways? So we both play baseball, so we have an idea of this as well. One of the things as a pitcher, it's not just the knee working, right? You have your hip, you have your ankle, and your knee all working in the lower body. So as you're pushing off, you're trying to gain the best mechanical advantage from your hip. And the way you're going to do that is pushing sideways. If I tried to push forward and jump forward, it's a lot harder for me to push off than it is pushing off sideways. I'm really trying to kick those hip muscles in. So that's probably why they want to do it. I'm not sure, I know obviously there's different types of positions that pitchers need to start in and things like that, but generally you're always trying to get to the best mechanical point to have the most power, and generally that would be from that side view. No matter where you're throwing from, you always get to that position before you throw.
Couldn't have said it better myself.
Cool.
So next question here is from Tiana. They asked, I've been having hip pain in addition to my usual arthritic knee pain. Could this be the result of the weather changing? I'm also a walker. Could it just be overuse? So a couple different questions here. In terms of the weather potentially being a cause of your pain, it absolutely can. When you have a bunch of different changes in the weather, whether it's cold, hot, it does affect your joints, especially in our areas with the winter that we've had. It's been awfully cold, so that does tend to stiffen some joints up. But also, having knee pain can also be a contributing factor to the hip pain. So when you are having pain in a different joint, it does throw off your mechanics, which can lead to further issues elsewhere. So, it's hard to say specifically what may be causing that hip pain, but the weather definitely can be a contributing factor.
Our next question was from Rylan, asking how can I strengthen my upper back or upper body muscles when it affects my neck so much? I have permanent injuries and I do get neck injections and occipital nerve block. So obviously you want to make sure that you are seeing the right medical provider in that situation to make sure that you're not doing anything to harm yourself. But there are definitely ways to strengthen the upper back in ways that are safe for you that should not affect your neck. In fact, it's super important actually that your upper body is strong around your neck to support it. A lot of times when we talk about the neck and different injuries and different things going on in the neck, the strength and stability in your upper body is one of the first things we go to. So there are ways to do that, safe ways to do that. You just want to make sure you're going to somebody who is going to show you how to do that better.
And we have our last question of the night here. So, are there everyday habits that could be harming my joints without me even realizing it? So, there definitely can be. What I tell most of my patients is if you are doing an activity and you're experiencing what I call more of a sharp pain, where it's a little bit more intense, generally that's an indicator that may be giving you issues with your joint. A lot of times I'll tell patients soreness, stretching, pulling, those sort of sensations are okay to feel. Those are normal normal sensations when it comes to movement. Now, if you don't have an exercise program where you're maintaining and keeping up with your body, it can lead to issues with your joints. So, everyday habits can potentially be causing issues with your joints, but that's not necessarily always the case. So, say thank you for tuning in to our joint class today. Again, I am Andrew Sipowicz. I'm a physical therapist with our Hamburg Village office.
And I'm Jake Woodrich over in Orchard Park.
Thank you again.